Good afternoon, everyone, and welcome. My name is Jamie O'Connor, and I'm with Family Voices of Minnesota and the Connected program. We're here for a webinar today that is part 2 of a 2-part series for new parent advocates. We're going to be talking about navigating healthcare systems and tips and tools for new parents. Before we get started, I just want to introduce any of you who are not familiar with Family Voices of Minnesota to our program. We at Family Voices of Minnesota and the Connected program, we provide information, assistance, resources, support to families who have children or youth with special health care needs. Often support is through our volunteer support parent network. So we have over 180 trained volunteer support parents throughout the state of Minnesota who can connect with other parents. They're matched on the basis of similar diagnoses, experiences, needs. We offer emotional support and understanding, encouragement, and education to support parents. Family Voices of Minnesota is the state affiliate organization for Family Voices National, and the Connected program is the state alliance member of Parent to Parent USA. So as I mentioned, this webinar today is part 2 in a 2-part series where we were really aiming to reach new parent advocates. And part 1 is available. I will send this PowerPoint out to all of our participants, and you'll be able to access the link more easily that way. But if you'd like to listen to the archived part 1, it was really excellent. It was around the diagnosis, grief, processing, communicating diagnoses, just the initial beginning of becoming a parent advocate. And today we're going to talk about those first few doctor's visits and how to navigate your new role in advocating for your child in what can be a really complicated and overwhelming system. So I'm going to introduce our parent panel today. And again, my name is Jamie O'Connor. I am the Outreach Coordinator for Family Voices of Minnesota. I'm also the parent of a child with special health care needs. Jess Randall is with us today. She's the Parent Support Navigator for Family Voices of Minnesota and Connected. And Jess, will you tell us more about your family?
Sure. So I live in rural Minnesota with my fiance and our 2 children who both have complex medical needs. My son Isaac is 7 and is just finishing 1st grade, and our daughter Ivy is almost 6 months old. In my role with Family Voices, I have the opportunity to help other parents navigate healthcare systems, access information and resources that they need, as well as help them advocate for their children. So I'm really excited about this webinar and to be sharing some tips and tools with all of you.
Thank you, Jess. Also with us today is Trisha Brisbin. She's a program coordinator for Family Voices of Minnesota and Connected. Trisha, I'll let you introduce yourself and your family.
Thanks, Jamie, and thank you guys for having me here again today to talk a little bit about something very important to me. My family, I live in the western suburbs with my husband and 3 stepchildren. Who are 16, 13, and 11, and my son, Charlie, who is 9 and has complex medical and special health care needs, and he is just finishing the 3rd grade.
Thank you, Trisha. So it's pretty rare for any of us to come to the world of having a child with complex healthcare needs with a ton of experience advocating in the healthcare system. And I certainly did not. My relationship with doctors was to do what they told me and move along. So I'm hoping, Jess, that you and Trisha can share. Jess, you can start about what you would go back and say to yourself at the beginning of your role as an advocate for your kids from the vantage point now where you have more experience?
Sure. The first piece of advice I would give back to myself is just a reminder that you have to be your child's voice. Starting out when my son was in the NICU, I had to speak up and ask questions because he couldn't, and that's just kind of continued throughout his life. And I often remind myself that that is my job as his mom, so I can't let myself feel bad about asking questions or feeling like that parent who might need extra time at a doctor's appointment or might ask additional questions from the nurse, because I have to be able to really understand things and process them to be able to help him and help coordinate his care. And my second piece would be to trust your gut. If something doesn't feel right or you don't understand something completely, take the time to ask more questions, get more information, especially when it comes about making decisions for your child's care.
I'd like to just add something to what Jess said. This is Trisha, and I think that what I would go back and tell myself is to really believe that I'm a partner in my child's care and that I am an equal in that doctor's appointment or while my child's in the hospital. So really what Jess said is, asking questions and looking at myself. I would ask myself to look more at myself as having the confidence to ask the questions when there's something I don't understand, ask for alternatives, what's the purpose of what we're doing, all of those types of questions that really just I have the confidence to do now. But like Jamie early on, I thought my relationship with the doctor was to just do what they said, and that's how I was going to advocate for my child, and I've learned so much more since that time.
Thank you both. I took this quote off of some of the resources that Family Voices has developed that will be shared at the end of this and also in an email following the presentation. But I think that we can use this reminder at every point in our journey, and that's that we know our child better than anyone does, and we need to have an active role as an equal member in their healthcare team. We have a very specific expertise that the doctors don't have in knowing our child. Excuse me. So one of the first things that we find ourselves doing when our child is diagnosed with a special health care need or when health concerns come up is looking for the right providers. So I wanted to open this up, and Jess, I'll let you start off talking about finding providers and this very initial piece of the primary care provider and their role.
Sure, thank you. I think it's really important to have a good understanding of what your primary care doctor can be used for and what they can do. I do believe my son sees 9 specialty providers that are metro located, so about 3 hours for us. And we use our local clinic is where we see primary care, and they do a lot of kind of the legwork for us. We see them for more than just well-child visits and immunization. They really help with referrals, coordination to other specialty providers that my child may need to be seeing, and then they're really good at looking at all of the needs of my child and our family and not just their specific department. So, our neurologist really focuses on brain and development that way, where I feel like our primary doctor kind of looks at the big picture of things and is also really involved in the needs for our family and the goals of care, what we want for our children, and how can they help us get there.
This is Trisha, and I really support what Jess said, and I think that we've had a couple different experiences with primary providers in the past, and for my son Charlie, it has been a game changer to be able to utilize primary care as kind of that hub that really keeps everything coordinated for us and really knows Charlie and understands the myriad of needs he has. And that has really helped us in finding other specialty providers that are a good fit for us. And so we look to our primary care provider, the pediatrician, for that as well.
I'm hearing both of you talk about primary care as a place to go for care coordination, and I know that that is not a reality for some families. I put the definition of care coordination in here as the deliberate organization of patient care activities between two or more participants involved in a patient's care to facilitate the appropriate delivery of health care services. And I think beyond that is what Jess and Trisha both mentioned. This is to facilitate the appropriate delivery of healthcare services specific to a child and their family and their needs and their goals. So we'll talk more about care coordination throughout this, but I feel like early on I saw myself as the care coordinator, and I didn't realize that I could aim for having a primary care or a primary care office where a care coordinator was an actual position that you could ask for. So there is just the work of actually finding the right doctors for your child, and sometimes we ask the question of, oh, who is the best doctor? But Trisha, maybe you can start and talking about how you have gone about, or how you would suggest we go about finding the right providers for our children.
Thanks, Jamie. So I think it's really important to decide what is important to your family. What's the priority for you and your child? And you can formulate questions based on all of that. And I often share this story about how I was able to make a determination of a craniofacial specialist that was the best for my child. We had a surgery coming up, and so when you're visiting all of these other specialists in that time period prior to that surgery, everybody's saying, all of the specialists are saying, what's coming down the pipeline? What are you guys focusing on now? And I would tell them that my son was going to have this procedure, and they'd say, who is doing it? And I'd tell them the name of the physician. And all of the specialty providers that we saw, maybe a handful during that time, said, oh, that physician is the best. Hands down, you've got a good one there. At the same time, I was connected with other parents through social media and also just through other avenues in my life, and I had heard some other families say that they really didn't like this provider and thought that he lacked a lot of bedside manner. So what I had to do was really think about, what's important to us. And because this was a craniofacial procedure that was close to my son's face, I decided that for me it was more important to forego maybe some of what this individual provider lacked in bedside manner or in, hugs and kudos, to say, you know what, he's really revered by his peers as one of the best, and so I'm going to choose that as our priority when it comes to this upcoming procedure. And I think that was a really important thing for me to look at and be introspective about, because there are times when I do think that communication and bedside manner do supersede anything else, especially, if we were going to be in for a long hospital stay. I may rethink that, but I had to decide what was best for us, and in that case, I think it was a true success, and I felt really confident in our decision.
Jess, you do a really great job of talking about, the practical pieces of how do you actually find the specific specialist or provider that your child needs.
Yeah, so again, like Trisha said, deciding what's important to your family, one thing to always keep in mind is insurance. So on the back of your insurance card, you can usually call a number there or look online to see which providers would be in network and would be covered. And some other things to just kind of keep in mind when you're making that determination of location. Like I said, we live in a rural area, so we might have to travel a little more to see specialty providers or physicians, so that's something to keep in mind, as well as their availability. Our primary doctor was really great when she was pregnant and planning to go on maternity leave, and worked up a plan before our appointment so that we knew who to contact in her absence. So that was really important to us, and just some of those things to keep in mind and to ask for when you're kind of planning ahead. When you are looking for a provider, you can also go on the website for the clinic. Many of them have provider profiles where you can read a little bit more about them. Some are able to provide a review where you can look at experiences of others. They might use like a star rating system, but that's one avenue you can look at. And as Trisha had mentioned before, you can kind of ask around to other parents to see if they have experience with that individual provider. And I think on that note, it's just important to mention that that's always a matter of opinion and experience. So what is important to you and your family may be different from the next person. And my example of that would be, we saw a specialty provider that Trisha highly recommended. She had nothing but great things to say about her. And then when we saw her for my son, I did not have that same takeaway, and it was just a very different experience. So I think we had different expectations, and we were at different places in our journey, which made our experiences very different with that provider. So it's important to know that just because you see a provider once, that doesn't mean that's the only provider you can continue to see. You can always seek out additional resources or second opinions as well.
Thank you both. I've had this experience, the same experience you guys have had, where one person's best doctor didn't necessarily fit our needs and vice versa. And another big part is around what are you using that particular specialist for compared to what other people are using them for. Jess, one of the things that you have mentioned in the past related to finding providers in rural areas are outreach clinics. Can you explain what those are and how to locate them?
Yeah, so personally, a lot of the specialists we see are down at Gillette, and Gillette has several outreach clinics throughout the state. Sometimes it kind of works. There are certain providers that travel to these clinics. So one example might be like PM&R, where you wouldn't necessarily have to drive down to St. Paul to see that provider. They might come somewhere closer to your location. So for example, for me, that would be the Alexandria or the Brainerd Clinic. When you're looking on the websites for these kind of bigger facilities, they will have a list of their outreach clinics. Or if you just call scheduling or talk with your primary care, they'll be able to help identify if there's a location where you can do some of this stuff that's closer in proximity, if that's something that's important to you.
If I could add something here, and I think it's really important to realize that sometimes we don't have a choice of provider due to maybe that location that we're in, or maybe there's a shortage of those providers or that type of provider. And so something that I've learned is really important is, any provider that my son sees is to really clearly communicate. That's the foundation of that relationship with that provider, is clearly communicate what our expectations are and ask them what do we hope to accomplish today. And when they talk about tests and assessments, I can ask, well, what will, once we get results of those, what will that tell us, and what kind of information do we hope to learn? So I think that communication piece, regardless of who you see or feel that maybe you are, have to see, is really important.
I agree. I think it's important that no matter the provider or your feelings towards them, that you work to develop a partnership. As it's been mentioned before in this webinar, we want parents to have an active role in their child's care, feel empowered, and feel that they have the courage enough to be an advocate. But I think a lot of that comes down to that partnership and collaboration with the provider, regardless if, they're a great fit, because as Trisha mentioned, there might not be a lot of providers available in that specialty, or some are scheduling a year out. So you might just have to see someone, and what can you do to kind of make that work?
I know one thing that I was surprised about when we were in the position of having a couple of different specialists that for my daughter, that where we didn't have a lot of options, was that you can actually partner with a provider to get second opinions. In other words, we had my daughter's records sent out of state to a place where there was a clinic that specialized in her rare disorder. And so we actually worked together with our provider to connect other providers to share information. And that was a really great collaboration and relationship. So we are going to move on to preparing for a clinic visit. And again, we have some wonderful handouts that will summarize this, and I will also send out the PowerPoint to folks. But I wanted to start with Trisha and just going through. I remember sitting there just very emotionally charged and overwhelmed, and was I just going to get more, terrible information, and not feeling terribly prepared the first few times that I went to a clinic visit. So can you talk about the process of preparing and how to organize all of those thoughts before you go?
Absolutely. Having a list of questions, I think, is one of the most important things. Excuse me. And I always try to think about, if it's a specialty appointment, say neurology, I try to think about what are the important questions that I want to ask the neurologist. But I also feel that it's important to kind of summarize where Charlie is at as a whole. We talk about, if mobility is an issue right now and it's really a priority that we deal with that, and this is just a 6-month check-in, that I still share that with the neurologist so that the neurologist can understand that in the context of my child and kind of what's important to us. I think bringing that list of questions is really helpful, and I used to always write the list of questions and then forget it at home, but I have really become more reliant upon my phone to just take notes. And I think I even got this from Jess, but if we have height and weight done, I will just go ahead and put that into my phone, and I'll mark it with the date that we had it done and where, so that if that's something that's going to set my child off, I can make sure that, if at all possible, they can use the most recent height and weight as long as it's still pertinent for the purpose that we're being seen that day.
Trisha, I think it's a really good point that when you go to these visits, you're not just there to receive information, because you are, but you're also there to share information. These doctors may not know all of the different things that have happened with your child in the past year, or where your priorities are, and where they've changed. Jess, I when we spoke about this off of the air, if you will, I was talking about how emotionally charged I could be and how I would try to come down from that in order to participate. And you said something really wise about being able to articulate why I'm afraid or what our frustrations are. Can you talk more about that as a way of advocating?
Yeah, I feel like that's been something that's been pretty helpful for us in the past. My example would be about changing some seizure medications for my son, and I just have a lot of fear about that and a lot of questions, and I can ask the provider a lot of questions and they can answer them. But when I was able to acknowledge, that I'm afraid of A, B, and C, I think the provider was really able to take a step back and explain things in a different way that kind of put me at ease. It didn't take away my fear, but we also took that as an opportunity to develop a plan. So example would be exactly what we're monitoring for, when I'm going to contact for follow-up, more visits, more check-ins, things like that. And just having that plan in place made me feel a lot more confident in my ability to care for him as we're making this change. So I think it is an opportunity to really kind of relate with your provider and let them know kind of how you're feeling and what's going on, and then can kind of move through those feelings and develop a plan that might make you feel more comfortable.
Thank you. Trisha, you had mentioned preparing your son for the clinic visit, and I know you spoke a little bit to that, but can you talk more about, when is that appropriate and what do you do to prepare him?
I'm sorry, is that for me or Jess?
For you, Trisha.
Okay, sure. I think it can be challenging because it depends on your child, and you know them best and what they can handle. But with my son, preparing him the day before is always what we do. And we talk about whether or not he will miss school and whether or not mom's going to pick him up, or what the plan for the day is going to be. That's really helpful. And we've even started something that I think is really helpful, a trick I learned from another parent. But it's really important that Charlie learn to become a self-advocate as it's appropriate for him. Although he struggles with making eye contact sometimes when he's talking, we always prepare him to, at the doctor's appointment, look the doctor in the eye and ask one question. And it can be anything. It can be, what's your favorite color? Who's your favorite Avenger? How am I looking today, Doc? It doesn't matter. But it's just to get him used to being a self-advocate and developing a relationship with his physician. And I think it's easy sometimes to forget that as our child's voice. But slowly, I think as it's appropriate, we can, find those opportunities to encourage them to really develop the relationships themselves.
Thank you. Thank you. So before we leave this, Jess, you and Trisha both have brought up to me some really important questions to ask sort of as your hand is on the door and you're preparing. And then I'll just mention regarding being prepared to schedule other appointments. I can't tell you how many times this still catches me off guard. So most of us use our phones for calendars, but one of you mentioned bringing your calendar and being prepared to go ahead and make that follow-up appointment. But can you both talk about sort of how are you recording what you're talking about, and then what questions are you asking on the way out?
Sure, well, I can go first on that. As Trisha said, I usually just in the notes app on my phone keep track of height and weight, and that can be referenced at our next appointment. My son has a lot of sensory issues, so that can be a trigger for him, which can make the rest of the visit very challenging. So I always kind of keep track of that, as well as the plan for follow-up, whether we need to come back in 3 months or 6 months. We see endocrinology, and they gave us a list of labs that needed to be drawn if at any point over the next year Isaac were to have blood drawn. And I just asked them to write them down, and I put that in my phone so it was always with me just in case for whatever reason we ended up somewhere that was not able to access that order, so that we could save a poke later on. And it's also important to find out how the information from that visit is going to be shared. Do they automatically send it to the primary care doctor? Do you have to ask for that? Can you access the note through the patient portal or the MyHealth or whatever the facility may call it. But it's nice to be able to access that information. We recently had a visit with our primary care doctor after having an inpatient stay, and our primary care doctor was able to kind of go over some results of a test that we hadn't even received information on during our stay because she had already received the notes. So that was really helpful and took one thing off my plate that we needed to follow up on. So whatever system works for you, whether it's a notebook or an All About Me care binder or an app in your phone, it's just important to kind of write down some of those important things to help jog your memory down the road.
I would agree with everything that Jess said, and I think it's also important sometimes as we're coordinating multiple providers for our child to not be afraid to ask, who else on Charlie's care team would have some valuable input or valuable information that we should consider. And so, like, PM&R, which is physical medicine and rehabilitation, oversees a lot of the mobility stuff. And at one point we were dealing with Charlie's hip dysplasia. And so there was an orthopedic surgeon that really needed to be involved in these conversations. And while I didn't believe that there was any way that I could get both providers in the room at the same time, I did feel it was important for them to have a conversation. And so I simply asked PM&R if they could check with the orthopedic surgeon and if they could consult or confer, and then one of them to get back to me with what was decided. And I just that was so easy, and I never thought that was something I could do, but it was so easy, and it gave me so much more confidence in the path that we were going to take to deal with the issues of mobility. And it's always important, too, that if they're going to do something like that, you ask when you could maybe expect to hear back from them. Do they mean a day or two? Do they mean a week or two? So that's a tip that I've learned, but has been really valuable to us.
So we go to these appointments and we get tons of information, and we go home and we process it, and inevitably we end up on the internet or on social media, and we're asking more questions. So I have sort of a two-part question. One is about what do you do with your unanswered questions at the end of a visit, or the questions that arise after a visit? And then in between those visits, how do we find reliable information? Jess, do you want to start?
Sure. I don't think we have mentioned that when we're kind of compiling that list of questions prior to the appointment, if I have a lot of questions, I might email them to the provider in advance, and that might allow them a little more time to prepare, to kind of let them know exactly what information I'm looking for. So they might be able to provide me with a good resource or some additional information regarding my questions at that initial visit, but it never fails. After the visit, I always think, oh, okay, well, what about this? What about X, Y, Z? Why didn't I ask about this? So I always make sure to write those questions down. Is it something that can be saved for a follow-up? Well, that depends on, are you following up with the provider in a week, in 3 months, in 6 months? So you kind of have to determine, how long you're okay with not having an answer for that. And I think it's also important to make a plan with each provider about what's the best way to contact them if you have a question that comes up in the meantime, when you're not scheduled to see them for another 3 months. Can you email them? Can you utilize a patient portal? Do they have a specific nurse you can contact or a telehealth line that might be able to answer some of those questions in the interim? So I think it's important to kind of have a communication plan in place so that you're able to find a way to get answers to those questions. And I think the providers, for the most part, when you're letting them know that you're looking for information on a specific topic, they can help you seek reliable and accurate sources so that you're not just on Google grasping at straws.
Yeah, I think that one of the things I've learned to do is if I have unanswered questions, I've gotten the confidence somehow to go back to the provider and just say, hey, I forgot to ask this, or I had more thoughts about this after I left. But I also at times have found it really helpful to talk to other parents and, do a little Google research. And I think that all of that can be helpful, but you have to then think about, okay, that source is providing that information, whether it be another parent providing information or an organization providing information. They're providing it because that's what's worked for them or from their experience, or that helps further their mission. So I think it's important to take that under advisement and think, okay, now I need to go back to the team and say, I've learned of some new things or I have some new ideas, but really take those back to your child's medical team and say, what do you think about these or my child? So if I hear about a new therapy that's coming out that's going to help potentially with children like Charlie and their mobility, I write it down, I take some notes, I do a little research. I like to talk and see if there's another parent who's had experience with that. But before I do anything or pursue anything, I really want to talk with Charlie's team, for example, PM&R, and his physical therapist, about what they think about that as a treatment for Charlie or a therapy for Charlie, because they have a medical expertise level that I don't have, and that's just as important as my expertise as Charlie's mom. And so I think that the accountability there is, we have to take accountability, but we can ask the providers to take themselves or hold themselves accountable as well. So we make those decisions together based on what's best for Charlie.
I think that's a really good point, Trisha. Often what does me in if I use a Google search or get information from another family's experience is that if I sit alone with that too long without bouncing it off of the other people on the team for feedback, then I don't get the real information that I need from it. So I'm saying what you said in a different way, that I just have really experienced that as being a potentially valuable source of information as long as it's received as a team.
Exactly.
So we already talked about sharing and recording information, but I want to make sure we circle back around about the care coordinator role and how to ask for that and where to seek that. And I feel like since I learned about the fact that there are people who do care coordination in clinics, that now I'm at the place where every time I go into a new clinic, I ask that question. So Trisha, can you start? And some of this will be a recap of what we've talked about, but it's just so important. Can you talk about where to find care coordinators and what they're meant to be doing as a team member?
Sure. And like you said earlier, Jamie, I think that there are very few clinics who offer a formal care coordinator in that role. But there are folks at the clinic that are doing some of those jobs and doing some of those things. So, for example, there is somebody at my child's clinic that I can call, and I can ask the doctor, who do I call if my child gets sick during the night or on the weekend? Where should we go? And that in one of my child's clinics is actually a nurse, and she is some type of nurse coordinator. At my child's primary care clinic, we do have someone that acts as a care coordinator, and she helps me with things such as keeping all of Charlie's tests, records, and things organized. And also, we work together to develop a care plan for Charlie. And this isn't like a discharge care plan from the hospital. It's an overall plan of care that we're able to develop that really covers all the bases with Charlie. And again, that's something that is a tool that helps me feel more confident. So I think that even if your clinic doesn't have a specific care coordinator, you can identify some of the things that you would really like some help with or some ideas that you've heard about and you want to investigate more, and ask the provider, is there someone here at the clinic that can help me with that?
Yeah, I think often we, as parents, are the care coordinators, but I don't know about other parents. It didn't occur to me until I joined Family Voices that I could be asking for help with that particular job. Jess, you've already hit on some of this, but when there isn't a care coordinator, can you talk about the process for developing that communication and coordinating the information?
Sure. As Trisha mentioned, not every clinic or system is going to have someone in the role of a care coordinator, but there's likely someone there doing similar work. They're just not given that title. So it's important to talk with your primary doctor or the provider about who is your contact person. As Trisha mentioned, if your child gets sick in the middle of the night, who do you call? How can you communicate with them? And each physician will likely be different, whether you call their individual nurse or you send them a message through patient portal or you send them an email. But it's important to figure out a communication plan prior to being in the need, prior to needing it. So again, if you have a plan in place for who to contact when Isaac spikes a fever of 103 during the night, that kind of takes some of the concern of who do I call and who does this fall under? Do I call a specialty provider? Do I call the primary? It's important to kind of work that out prior to needing it. And I think that just comes down to communication with the provider.
That's a really great point and a really great use for that. One of the things that we were thinking about at the end of this was, so we've got all of this information and we've worked to make sure all of the providers get it. And then what pieces of that are relevant in our day-to-day to other people who are not necessarily in the healthcare system? Trisha, can you talk about how you use pieces of information that you get in these appointments out in your day-to-day life and outside of the doctor's office?
Yeah. So I think that one of the things that has been most valuable is creating a plan of care with my child's primary care provider, because not only do we look for the input from all of his different specialists, but I can also get input from his karate instructor, and then we can in turn share that back with the karate instructor. We're really working on balance right now, and so the karate instructor can help kind of facilitate some ways that we can help Charlie work on that during karate. There's a lot of information that is so valuable to the school staff, and I think that being able to share some of that in a clear, concise manner with his school staff is really important. And rather than, just taking the results of our latest neuropsych eval and handing them over to the school, it's really nice to have a conversation about what those results indicate and how those results have an impact on what Charlie's learning in school. Jess, you might have some other thoughts on that too.
Yeah, I was thinking about what Jess said about asking what to do in the middle of the night. That's that direct application of the information that you're getting. Go ahead, Jess.
Well, on the kind of sharing relevant information with whom, I think kind of our example of that would be recently my son was inpatient for some neurologic concerns, and I could just hand the school the entire report, but that's overwhelming for me to read. So it's important to have that conversation on what do we need to watch for, what are our concerns, what warrants another contact or communication with the provider. So I can kind of break it down and simplify it and share that information with the school, which just makes things a little easier for everyone.
Thank you both so much. Again, in the slides that I will distribute to participants, I just put a link here to another webinar that our Executive Director, Carolyn Allshouse, presented. And there's the American Academy of Pediatrics has an emergency information form for children with special health care needs. And that is one way of condensing really important information in a format that you can provide to other people who care for your child, be it a babysitter, school staff, a co-parent, whoever, a grandparent. And so that's another valuable way of using the information and your relationship with your provider. So I thought that that was important to put here. We're going to open up for questions in a minute, but everything that we've talked about here in more of a story format, Family Voices has condensed into one-page PDFs on preparing for a clinic visit, what to do during a clinic visit, and then there's also just our general Facebook page on navigating healthcare. So those links and resources are really fantastic and will be provided as well. And I thought we could open up to questions. Feel free to chat them. I will also unmute
The
everyone.
conference has been unmuted.
While we wait for questions to arise, Trisha and Jess, I was curious if you guys could condense down into a couple of sentences, just a piece of encouragement for parents who are just starting out on this journey. I think it still feels kind of fresh for what it was like to start taking those first steps into the unknown.
You know, Jamie, that's really true, but although I've gained more confidence, I still find myself evolving even 9 years later. And other families that I talk to will say it's a journey that never ends. We just maybe get a little better at it and feel a little better about it. But one of the things that when folks talk about advocacy, to me, that I think of is that advocating for my child does not mean that I pound my fist on the table and I say this is what I want for my son in most situations. In most situations, it's much more complex and it involves communicating with my child's providers. It involves a lot of listening as well, reflection, and I think that it really involves true partnership with my child's healthcare team, and whether that be, I think of that broadly as, school professionals, mental health providers and physicians, therapists, recreational directors and folks who help us with that. It really is that advocacy piece is about communication and stepping back and really trying to make sure that I am clear and effective in my communication so that we can achieve the best possible outcomes for Charlie.
Thank you, Trisha. That's a lifelong journey for me, for sure. Jess, Trisha took more than 2 sentences, so you can too. What piece of encouragement would you give to yourself or the new parent advocates who are taking these first steps?
I think Trisha phrased it very well, that this process is a learning curve, and you have to allow yourself some grace while you're learning and figuring out how to partner and communicate with providers as well as advocate for your child. And my son Isaac is 7, and I will never say that I feel like I have this all figured out. When Ivy came along and we had an unexpected hospital stay, because I had been through it before, I would have thought that it was easier, but it definitely isn't a second time around or in a different circumstance. So it's important to just allow yourself some time to process things, and just keep your child at the forefront, and remember that's what you're doing these things for, and try to be a good communicator and a good partner on your child's team, and that makes things easier no matter the avenue, whether it's healthcare or school or therapist. I just think those are important roles.
Trisha and Jess, thank you so much. I love hearing your stories and having access to your advice and this information. Again, to everyone, I will send out the slides as well as a link to the archived version of this. When you exit the webinar, there's going to be a short survey. And just to say that at Family Voices, we strive really hard to make sure we're putting out content that's relevant and really resonates with families. We know your time is precious. So if you can take just a couple of minutes to give us feedback, that will help us continue on that journey. Thank you guys so much.